Tatiana Alexis here. Thank you for coming and watching on my channel. I appreciate the comments that I have and the views. I wanted to do an update on my Nuvaring experience. I used Nuvaring from September 2017 up until May 2018. That was 10 months of use. I didn't experience any side effects from the Nuvaring. The choice to use the Nuvaring came from not being able to use oral contraceptives or the depot shot or the implant in my arm, which was the Nexplanon. So my next choice was to try and use a different form, which was the Nuvaring. The Nuvaring was easy to use. You place it in after your period, keep it in for 3 weeks, remove it, and then your period will come on like clockwork. One thing I said about the vaginal flora in the 2-month video was that it will cause you to have issues such as yeast infections. But it also, you have something called bacterial vaginosis, which is the also loss of imbalance of your vaginal flora, and it could cause you to have a fishy, watery discharge, and I think it's caused by the Gardnerella bacteria, which is an overgrowth of. So that's also the issue that you could have, and that's what even with douching, which is frowned upon. You can have that issue with that as well. So I was looking through the comments, and I just want to address a few things. So one young lady said they were sitting in debate and put a Nuvaring in the very moment. It was literally in their hand. They ran across the video for more information. So I'm glad I was able to help you make that decision if you did, or give you some more information while you were trying to contemplate that. It says this birth control method I'm looking to start with. So yes, do an update. They enjoyed my video. Thank you so much. One of the other questions I had was, did they charge for the applicator that I got from the Nuvaring website to help place the Nuvaring inside of yourself? They do not charge for the applicator. So if you could get on there, if that's still an option, put the information in, send it to your house, and then it makes it a lot easier to put in. After a while, I got more comfortable with the Nuvaring and didn't need the applicator, but it just helped me get it in the correct position. So someone said they used the Nexplanon for 3 years and the bleeding was awful. They were now looking for the Nuvaring, but they were unsure. I can't suggest that you need to use this particular method of birth control. I can just tell you my experience. I did oral contraceptives of different types, progesterone-based, estrogen-based, and one thing about that is you have to take it every day at the same time. So it will make me nauseous. And then I had these mood swings, which it helped balance my moods hormonally, like when I was PMSing, but I also had just this breakthrough craziness, I call it, psychosis almost. So I was like, this isn't going to work for me. That's why I went to something else, because first of all, if I didn't take it consistently, I put myself at risk for getting pregnant. And then also, like I said, gave me the imbalance to where I didn't feel like myself. And I didn't have any issues with it. Placement was easy. Remembering it, I had a reminder on my phone. They also have an app, I believe, you can download to use to remind you of when to place it and when to not. And I chose to use a different app because it helped me monitor other symptoms and things. But yeah, it worked well for me. I didn't have any problem with it. The only thing was the effectiveness was only 97%. Now, someone else said that they have an issue with vaginal dryness. They're looking to start the Nuvaring. I also experienced that with oral contraceptives, but with the Nuvaring, I also experienced some vaginal dryness. I didn't experience as many yeast infections as I did on birth control, but there is some risk of that, I feel like, as well. But it's all depending on your body. Like, I did depot at one point and got the shot, and it made me spot continuously. So that's when I had to go back to oral contraceptives. I had a family member also try it, and she said it did the same thing to her. So I don't know if it was something hormonally with our bodies, but I know specifically for myself, it did not work well. And I have a gentleman here that says, be careful with the hormonal contraceptives. Having different types of devices inserted into your body, which are then used to induce synthetic hormones into your body, is like a bad thing. And they said that he realized more women are limited with their options, but please explore natural alternatives, which are safer first. Which, that's completely your opinion. If you choose to do something more natural first, or if you choose to implement additional hormone management with the oral contraceptives or with the implants, that's your particular choice. But with any choice you choose, there are side effects. There are risks to using them. So I was going to go over some of the risks that I found on the Nuvaring website for the Nuvaring specifically. But most with any birth control, your side effects are, one major side effect is developing blood clots. With any medications, period, that you take, your healthcare provider should provide you with the benefits and the risks. The benefits are the reason why you should choose it. The risks are the side effects or things that could occur and happen in your body and that you could experience while using this particular medication. So one thing I've seen on the Nuvaring website, which is nuvaring.com, the possible risks and side effects for this include blood clots. It says, like pregnancy, combination hormonal birth control methods increase the risk for blood clots, especially in women who have other risks such as smoking, obesity, or age greater than 35. This increased risk highest when you first start using the combination hormone birth control method, or when you start the same or different combination hormone birth method after using it for a month or more. Talk with your healthcare provider about the risk of getting a blood clot before using Nuvaring or before deciding which type of birth control is right for you. And places that the Nuvaring has a side effect for blood clot development could also lead to heart attack and stroke. So with those different things, the hormone changes cause you to have changes in your body. Okay, with those changes, you develop a blood clot. A DVT, a deep vein thrombosis, is a blood clot in your vein. A pulmonary embolus is a blood clot that has traveled and lodged itself in your pulmonary arteries. You can also have it lodged in other places. You have it lodged into one of your arteries on your heart, which causes a heart attack. You can also have it come and cause a clot development in your brain, which will cause a stroke. Places that they can occur are your legs, lungs. They can cause loss of eyesight, heart attack, and also again it says in your brain, which causes the stroke. So blood clots risk seem to be higher in, it says postpartum 12 weeks, but they have a chart here on the website that helps you determine what your risk is. Because they give you this information, this is all information that they consume from data. What specifically happens for one person may not happen to you, and what may happen to you may not happen to someone else. So if you have a leg pain that doesn't go away, sudden shortness of breath, sudden blindness, partial or complete, severe pain or pressure in your chest, sudden severe headaches unlike your usual headaches, weakness or numbness in an arm or leg, and trouble speaking, yellowing of the skin or eyeball, you should follow up with your healthcare provider and emergency medical services immediately. Just immediately. I would say emergency medical services and notify the healthcare provider if you are in a position to do so. Things that you should look for are toxic shock symptoms, which are mimicking similar to the flu, sudden high fever, vomiting, diarrhea, sunburn like rash, muscle aches, dizziness, fainting, liver problems, high blood pressure, gallbladder, accident, insertion into the bladder. Oh Lord. It just goes on with the different things you need to look for with using these different things. And basically this just describing different effects of different organs in your body and how they will manifest. So with using birth control, there are risks. My experience with the birth control is Nuvaring worked for me. I didn't have any experience with blood clots, any experience with any issues. Besides the effectiveness. So I would say to you all, talk to your provider, your OBGYN, your primary care, whoever's prescribing the medication for you, and talk about your options. And, take the time to ask questions. Have your questions written down, have them saved on your phone, whatever you have to do to make sure that you have a clear understanding of what you are putting in your body. So that is my 10-month update. I am no longer using Nuvaring, and I'm going to close this video with asking you to like, subscribe, comment, and please look at my other videos. Caution, I was not very camera savvy prior, so the focus was a bit bad. My lighting was a bit bad. I don't know if it's any better now, but I'm just trying something else until I find what works for me. But please subscribe, like, and comment. And I would like you to please put your information in the comments, which will give other people more information about your experiences or about what you're deciding your choices are if you feel comfortable. So the next video I do will be about my current use of birth control and what all changed for me in the last few months.